Today, let's talk about intubation injuries and how they can impact the voice. When patients undergo intubation, especially for prolonged periods, there are risks to the delicate structures in the larynx and surrounding areas. These injuries can vary widely, but they all share a common challenge. They can significantly affect the patient's voice, sometimes permanently. First, let's start with intubation granulomas. Granulomas are inflammatory growths that usually develop on the vocal processes of the arytenoid cartilage. They often result from prolonged irritation or trauma caused by the endotracheal tube rubbing against the larynx during intubation. Patients with granulomas might experience hoarseness, a sensation of something stuck in their throat, or even pain when speaking or swallowing. These granulomas are typically treated with voice rest, steroid injections, or, in more severe cases, surgical removal. Next, we have vocal fold polyps. Unlike granulomas, polyps are fluid-filled lesions that can form directly on the vocal folds. They often develop in response to trauma, and in this case, intubation can be the trigger. Polyps affect the smooth vibration of the vocal folds, leading to a hoarse, breathy voice. Treatment usually involves a combination of voice therapy, and in some cases, microsurgical removal if the polyp persists and disrupts the patient's voice quality. Another potential injury is cricoarytenoid joint fixation. The cricoarytenoid joint, which allows the vocal folds to open and close, become fixed or immobile after intubation, especially in cases where the tube causes pressure or trauma to the joint. This condition can lead to a restricted vocal range and breathing difficulties, as the vocal folds cannot move freely. Joint fixation is a complex issue and often requires a combination of anti-inflammatory treatments, physical therapy, or even surgery to restore movement. Then there's subglottic stenosis. This is a narrowing of the airway just below the vocal folds, often due to scarring from prolonged intubation. Patients with subglottic stenosis may experience difficulty breathing, a weak or breathy voice, and a high-pitched sound when inhaling. Treatment for subglottic stenosis can be quite involved and may include procedures to dilate the airway or remove the scar tissue, depending on the severity. Lastly, let's talk about scarring of the vocal folds. Scarring, or fibrosis, on the vocal folds occurs when the tissue has been damaged and heals abnormally, leading to a stiff, less pliable vocal fold. Scarring prevents the vocal folds from vibrating smoothly, which can cause a hoarse, strained, or weak voice. Treatment here is challenging, as vocal fold scarring is often permanent, but voice therapy and certain surgical techniques can help improve vocal function. In all these cases, preserving and restoring the patient's voice is a top priority. Early intervention, minimizing trauma during intubation, and close follow-up with an ENT specialist can all help in managing and preventing these complications. For healthcare professionals wanting to understand these injuries in detail, the ENT lecture series by Dr. Sunil Kumar Sharma is an invaluable resource. Dr. Sharma delves into the complexities of each condition, treatment protocols, and shares insights into the latest advancements in managing voice-impacting injuries from intubation. His lectures provide a practical guide for ENT practitioners aiming to improve patient outcomes in challenging cases like these.